Stop. Before you scroll past this, I need you to watch the next 60 seconds very carefully. There is one silent sign happening in your legs right now that most people over 70 completely ignore. Not pain, not swelling, not a cramp. Something far more quiet, far more dangerous. And by the time most seniors notice it, it's already too late to reverse the damage easily. If you are over 70 or you love someone who is, please stay with me. This could genuinely change everything.
Let me ask you something simple. Have you noticed that your legs feel just a little heavier lately? Maybe getting up from the chair takes more effort than it used to. Maybe climbing a few stairs leaves you more tired than before. You probably thought, I'm just getting older. This is normal. But here's the scary part. It may not be normal at all. What feels like normal aging could actually be your body sending you a very serious warning signal. Here's what most seniors don't realize. Your legs are not just legs. They are your body's communication system. When something is going wrong deep inside, in your circulation, your nerves, your muscles, your legs are usually the first to show signs. Long before your heart shows it, long before your brain shows it, your legs start whispering a warning. Most people ignore the whisper, and then one day, the whisper becomes a crisis. That's why what I'm about to share with you today is so important.
So, what is this silent sign? Sign number one, and this is the big one most people miss. Your legs feel cold, especially from the knee down. Not just when it's winter outside, not just at night. Cold at room temperature, cold under the blanket, cold even after a warm bath. This is called poor peripheral circulation, and after 70, it becomes very common and very dangerous. When your blood is not flowing properly to your lower legs and feet, your tissues are not getting oxygen, and tissue that doesn't get oxygen begins to break down, slowly. Warning, if your feet or lower legs frequently feel cold and other people's feel normal, do not ignore this. This is your body asking for help. Silent sign number two. You notice your leg hair is disappearing. Now, I know that sounds strange, but listen carefully. If you look at your lower legs, below the knee, and you notice the hair is getting thinner or is almost gone, this is not just a cosmetic change. Hair follicles need healthy blood flow to survive. When circulation is poor, hair follicles on the legs are among the first things to die. Most seniors just think it's aging, and they never mention it to their doctor. But here's the dangerous truth. Leg hair loss, cold feet, and leg fatigue together can be early signs of peripheral artery disease. PAD affects over 8 million Americans over 60, and most of them don't know they have it. Silent sign number three. You feel a deep aching or cramping in your legs when you walk, but it stops when you rest. This is called claudication, and it is one of the most overlooked warning signs after 70. It feels like a muscle cramp or just tired legs. So most seniors slow down their walking and think nothing of it. But this cramping while walking and relief when you stop, that is your muscles screaming for oxygen that isn't arriving because the arteries carrying blood to your legs are becoming narrowed or blocked. This is serious. This is not normal aging pain. If this sounds familiar to you or someone you love, please take note. Write it down and tell your doctor at your next visit. Don't wait. Silent sign number four, wounds or sores on your feet or legs that just won't heal. Maybe a small cut, a blister, or a scratch, and weeks later, it's still there, still not healed, maybe even getting slightly worse. This one is dangerous, and I mean that seriously. When blood flow is poor,
Your body cannot send the healing cells it needs to repair damaged skin. A wound that doesn't heal is not just uncomfortable. In seniors with poor circulation or uncontrolled blood sugar, these wounds can become infected very quickly. And in severe cases, the consequences can be life-changing. If you have any wound on your foot or leg that has been there longer than 2 weeks, please see a doctor this week, not next month, this week. And silent sign number 5. One leg looks or feels different from the other. One leg feels more numb. One foot looks more swollen. One calf looks thinner than the other. Most people think everyone has one side slightly different, right? Wrong. A sudden or growing difference between your 2 legs is a red flag your body is waving at you. It could mean a blood clot, a nerve issue, or serious muscle loss on one side. Any of these need attention. Here's a simple test you can do right now. Sit down. Look at both your calves. Do they look the same size? Press your thumb into each ankle for 5 seconds. Do they feel the same? If not, don't panic, but do call your doctor and describe what you see. Better safe than sorry. I want to pause for a moment, because I know this is a lot to take in, and I know some of you watching this right now may have recognized 1 or 2 of those signs in yourself, maybe even more. First, don't panic. Knowledge is power. The fact that you're watching this means you're already ahead of most people, because most seniors wait until a crisis happens. You don't have to. The good news, and there is very good news, many of these warning signs can be slowed down, and in some cases even improved, with simple daily habits that take just minutes. Let me show you exactly what to do. Simple fix number 1. Walk. Every single day. I know, you may have heard this before, but here is what most people don't understand. Even a 10-minute slow walk after each meal dramatically improves blood flow to your legs. It trains your blood vessels to stay open and flexible. It reduces the dangerous buildup inside your arteries, and it costs you nothing. You don't need a gym, you don't need special shoes, just your front door and 10 minutes. If walking is painful, start with just 5 minutes. Go slower, but go. And if you have claudication, that walking cramp we talked about, walk to the point of mild discomfort, rest, then continue. That specific pattern actually helps build new small blood vessels in your legs over time. Your legs want to move. Give them the chance. Simple fix number 2. Elevate your legs every day. This one is easy, and it feels wonderful. Once a day, lie down on your bed or couch. Place a pillow or 2 under your feet and lower legs. Raise them just above the level of your heart. Stay there for 15 to 20 minutes. This simple position uses gravity to help drain excess fluid from your legs, reduce swelling, relieve pressure on your veins, and give your circulation a much-needed reset. If your legs frequently feel heavy, swollen, or achy by evening, this habit alone can make a noticeable difference within just a few days. No medication, no equipment, just a pillow and 20 minutes of your day. Make it part of your afternoon routine. Your legs will thank you. Simple fix number 3. Watch what you eat. Specifically, these 3 things. Number 1, reduce salt. Too much salt causes your body to hold water. This increases swelling in your legs and forces your heart and arteries to work much harder. Try to keep sodium under 1,500 milligrams per day. That's about 1 teaspoon. Number 2, eat more dark leafy greens. Spinach, kale, and arugula contain natural nitrates that help your blood vessels relax and open wider. Better open vessels mean better blood flow to your legs. Number 3, stay hydrated. Dehydration makes your blood thicker and harder to pump through your arteries. Drink at least 6 glasses of water a day, more if you can. These 3 changes are simple. They cost almost nothing, and they can begin protecting your legs starting today.
Before you go, I want to say something important. You watched this entire video because you care about your health, and that matters more than you know. Please share this video with someone you love over 60, a spouse, a sibling, a dear friend, because most people will never see this information, and for some of them, it could genuinely change their health or even save their life. Just hit that share button. It takes 5 seconds. And if this video helped you today, leave a comment below telling me which sign surprised you the most. I read every single one. Thank you for trusting me with your health today. You deserve to feel strong and well at every age.
Now, before you close this video, let me ask you one final question. Have you ever woken up in the middle of the night with a sudden sharp cramp in your leg? Most people shake it off and go back to sleep. But what if that midnight cramp was your body sending you a very specific message? A message that, if you understood it, could tell you exactly what your body is missing. I made a complete video on this exact topic. It's called Why Your Legs Cramp at Night After 70 and the one mineral that stops it. Click on it right now. It's already on your screen. I promise you, you will not regret it. Your legs are trying to talk to you. It's time to listen.